Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. Joining me today is the new CEO of DotCom Therapy, Dr. Omar Dawood. How are you today?
Hi, doing great, Jared. How are you?
I'm fabulous. I'm feeling so excited for you and the team, and obviously, I've had Rachel on before, so super excited for everything going on with you and DotCom Therapy. Would love if you could just tell us a little bit about your background, and we dive right into it.
Yeah, fantastic. Well, listen, this is a space I've been passionate about for decades. I had a journey here in healthcare that started off with me being diagnosed with stage 4 Hodgkin's lymphoma when I was 15. It's a pediatric, well, not just a pediatric, but a cancer that can affect children. Going through 2 years of chemotherapy and some surgeries, I really came out the other side and saw firsthand the growth, development, mental health challenges that exist and the really paucity of support that's out there. I also saw a view of healthcare that had very little innovation at the time, very little use of data, and saw a big opportunity to be able to help empower clinicians and bring more of a patient-focused, very personalized experience. So, kind of dedicated my career to that. I'm trained as a physician, trained in surgery and radiology, and I also have a background in public health, and so really kind of think about the world not just on a one-on-one basis, but in totality and how we think about resources and efficiently be able to support a lot of people. I was very lucky after spending the first part of my career in the medical device world to be at the forefront of digital health. And I helped innovate some of the largest adult offerings that you see out there over the last decade. Did a lot of things right. We made some mistakes along the way, but the important thing is that we learned a lot. And I think we help millions and millions of lives around the world, supporting stress, anxiety, demystifying mental health, providing new ways of accessing care and enabling clinicians. I'm really excited to bring a lot of those learnings to bear here now to the children, pediatric, and adolescent space. It's interesting, when we think about, individuals 18 and under, children and adolescents, it's such a huge part of our population. It takes so much focus from us as parents, just as we think about going about our day, as we think about doing really anything. If we're not taking care of our kids, it can be a huge stress on us. And for children and adolescents, with all the different pressures and challenges that are out there, not just through the pandemic, but from technology, social media, other aspects, the need to support that group is more than ever. And yet there hasn't been a whole lot of innovation in this space. And so I was just so excited to connect with Rachel and the .com team and have the opportunity to be part of this movement, to thoughtfully come in and really structure how we can actually start inflecting new ways of accessing high quality care, new ways of bringing artificial intelligence and machine learning to bear to enable clinicians to build more context around their patients, new ways to give transparency to parents so they understand what their children are going through, and to tie in schools, employers, and health plans into that whole ecosystem.
You had a lot of, I could just tell. That's why I like doing the video component when we're talking through this, is I can tell how excited you are to join this team. And it seems like there was a multitude of factors that made you want to join the team. Can you share a little bit, because you have such a background in this mental health space and beyond. Can you talk us a little bit about your outlook on mental health growth and the development, like what this space kind of looks like as we head into 2023 and beyond?
Yeah, great question. I think that the need is just growing in terms of supporting the mental health of children and adolescents. And part of that is because we are so connected as a society by technology and the pressures of social media. But additionally, I think there's an opportunity to do something here that we've been doing pretty well on the adult side, which is that it's not about just supporting children or adolescents that have labeled diagnoses that may have, a range of autism or may have a diagnosed depressive or anxiety disorder or a growth or development disorder. But literally every single child and adolescent, they have mental health they deal with. They may not know it, they may not call it out, but the pressures of growing up are there. And even if someone is nervous in an interaction with their friend before they go into a class, that all can manifest and develop later on in life if we don't actually support it. And what better time to help this growing, our growing children and adolescents learn ways to actually embed dealing with stress and anxiety and taking care of their mental health as a daily routine rather than just a patch when they feel something. So they carry that through to their adult life. You can imagine the long-term ramifications and the benefit to all of us. And so I think the need is there. I think it's growing. And I think this is the right time to actually start innovating and supporting mental health on a very, very large scale when it comes to our children and adolescents.
What what's next, and what excites you about your role and some of the things you're doing at DotCom Therapy that you can share at this time?
Yeah. Well, the team has done a very, very, very good job of being disciplined. I think under Rachel's leadership and the broader management team and every employee in the company, they have channeled behind the highest quality of care. They created a provider network that has over a 97% retention rate, which rivals the industry, which sits at about 50%, an amazing culture within the company. And they started off really going after IEP, which is mandated care that's required to be delivered for students, affects about 13% of students in schools. And that's hard to do. And instead of going after kind of the easier route of just access, they went after that. And that requires the highest level of care. And now from there, I'm excited to build on that foundation with the team. I'm excited to continue to build out that amazing, passionate, high quality network, to build on the success, to bring this to even more school districts. We have about 175 school districts around the country we're in, expand to mental health support, and expand into the employer world as well. I think that's a huge opportunity to start tying in all these different aspects of the ecosystem, which are critical. Because employees right now, they struggle with their 18 and under dependents and how to actually support them. I'd say the other aspect I'm really excited about is how we actually bring machine learning and AI to bear in this innovative area. It hasn't been used really in pediatrics and adolescents, and I think we can take a page out of some of the work that I've been involved with over the past decade, where this can really help us increase the efficiencies of providers, allow us to scale networks in really, really big ways so that we can take that high quality care that before was only in pockets by companies and be able to actually deliver it nationwide and potentially eventually globally as well.
Well, I'm excited to stay in touch with you and continue to see where .com Therapy goes from here. But I'm very bullish and very excited about what the future holds. Hopefully, we can have you come back on again on one of these panels that we do and put together some more content. But I wish you the best of luck in the new role and in .com Therapy as well.
Thank you so much, Jared. Appreciate it. Look forward to coming back and chatting with you more. Thank you, Ken.